enter the room.
Hello, the doctors here in this department. Could you please confirm your name?
Doctor, my name is Jolene Tucker.
Nice to meet you, Julie. And you are daughter of Mr. Tucker.
Yes, I am.
Could you please confirm his name and his age, please?
Yes, his name is Adam Tucker. He's 70 years old.
Yes, Julie. How can I help you today?
I'm here because I want to know about my father's current condition and what are you going to do further for his treatment, doctor?
Yes. Does anyone of the team or of the doctors updated you about your father's condition?
No, not yet, doctor.
Okay. How much do you know about the condition so far?
So my father collapsed at home while he was having breakfast 1 week back, and he was not moving, he was not responding to us. So we immediately called an ambulance, and in the hospital, the doctors who looked after him told us that he had a stroke. So he's been receiving treatment. Unfortunately, they said that they are not seeing any improvement. So today I was asked to come here because you have some important update about his condition. So I want to know, doctor, how is my father and what are you going to do for him?
Yes, I am going to answer all these questions, but is it okay to ask you more few questions?
Yes, doctor.
Does your father has any medical condition?
Yes, doctor. My father was having high blood pressure. He also had high cholesterol as well.
Yeah. Does he take any medications?
Yes, he was taking medications for his blood pressure and cholesterol.
Is there any history of previous stroke before this time?
No, doctor. No, doctor.
This is the first time.
Yes.
Yes. Does he have any weakness in his body or any numbness?
So before he collapsed, he was saying that he's having some weakness in his body, one side of his body. He was having some headaches. But then it happened all of a sudden. He collapsed, and when we came to the hospital, he told he's having a stroke. So it was a lot to take in, doctor.
Yeah. I am sorry that you go through all of this. Does your father lives alone or with you?
Unfortunately, he was living alone because our mother passed away 5 years ago. But I have a brother as well. So sometimes me or sometimes my brother, we both come and check up on our father.
Yes. I am sorry that you have this on your plate. You seem to have a lot. So Julie, about your father's condition, you already know that he goes through this stroke, and we start him on medications. A CT scan has been done for your father, and unfortunately, I don't have a good news for you. You need someone to be with you today when we are discussing this.
No, doctor, I'm okay. Please carry on. What happened to my father? What does the CT scan show?
Okay, so unfortunately, the scan shows that a big part of his brain is damaged.
Okay. I mean, so okay, his brain is damaged. So I'm sure this must be some treatment, right? I mean, you can do something to improve him, right? I mean, come on, doctor, he's going to be all right, right? I mean, it's treatable. Is it treatable, doctor?
So, Julie, we have done like a team, multidisciplinary team, and discussed the case of your father to choose the best solution or best option for him. So the team decided that it's better to refer him to palliative care. Do you have any idea about that?
No, doctor. What is it?
Okay, let me explain for you. It means that we will stop the ongoing treatment and start new arrangements. This means that we will stop the medication he is taking and we will start him on painkillers and medication that less intrusive to him. Is it clear for you?
Doctor, why are you stopping his medications? If you stop his medications, won't he die?
2 minutes remaining.
So usually the palliative care is taking care of the patient and make him comfortable as much as we can, not suffering from pain or anything. But taking the other medication to keep him or treating the stroke is he will not take any benefit from it. It's only aggressive medication to him, and the consultant and the other team members think that he will not take any benefit from that. It's better to for him to stop all of this and try to make him comfortable as much as we can, as a big part of his brain is damaged, and the chance for him to regain his consciousness or regain his brain activity is unlikely.
What do you mean by that, doctor? I mean, this is so much to take in. Can I go and see my father?
Yes, of course, you can see him. And I know that it's overwhelming and you have all the right to feel this way. But we choose the best option of our patients to feel comfortable, especially in this condition. The palliative care also can be done at the hospital or at home. We can discuss this later. How do you think about that?
Yes, doctor, that's okay. I just want to see my father. Can you please call my brother?
Yes, of course. Anything you want, we can call him and you can see your father as you want.
Okay, doctor, thank you.
Is there anything else we can
Move on to the next station.
Good job, guys. Good job. I think Dr. should have a good hold on what is breaking bad news. Great simulation.
Thank you.
So, Dr. Amira, that was an excellent performance. But I just want to add a few things. You know, I want to understand from this case, what do you think is the worst thing, worst news in that entire, information that you got? What is the worst news in this that you would be breaking to her?
the big stroke or the palliative care and stop the treatment of stroke?
Palliative care is a strategy, right? But what is the worst news in this case? When you were saying big stroke, it's affected most parts of his brain. What does that mean? What does that mean for the patient? You told this towards the end. When you're breaking the news, you needed to say the worst thing about that news, which is he is unlikely to recover. Because you left it hanging for her. She herself came by the, what does that mean? What does that mean for my father? When you're breaking the news, you break it entirely. Tell them to the
Yes.
point that, it's not very likely that he would come out of this. Right? That is the worst part of the news here. So when you're doing breaking bad news, it's a very subtle way of breaking the news, and you did a lot of good data gathering. That was actually very good. But you started asking about some previous symptoms and all. That is important. I mean, that is okay, but I wouldn't say it's that essential because you already know the diagnosis. You already know that he has stroke. right? How is this information going to help you in breaking the news at all? You know, try to understand that when you're doing data gathering, gather that data that would be useful for you to make the diagnosis. While in this case you already have the diagnosis, use the information that will be important for you to give management. Now, what would be the management? You need to understand that you have to break the news and you have to comfort the family. So you need to understand who is in the family, who is the primary caretaker of this person, who is the advance directive, right? Or does he have an advance directive or lasting power of attorney? These are the things that you need to understand, because these are the things that you will be talking about, right? So when you're doing data gathering, understand what you're doing data gathering for. Most of the time, you're doing data gathering for the management that's going to follow. So let's go through the breaking bad news, guys. So breaking bad news is done in the spikes protocol. So I'll quickly go through this. You had, initially when you asked, what's your father's name, mention the full name, Adam Tucker. So they want to see if you correctly identify the patient. So whatever information has been given to you needs to be used fully. Identifiers are very important. What if there was another person named Tucker? Right, so that's why they are giving you this information so that you can confirm it with the relative. Is this Adam Tucker that you're talking about? Is this 70-year-old person that you're talking about? Two identifiers which are not very likely to clash with others. There can be an incident that there would be a person with the same name and age, but it's kind of highly unlikely. So two identifiers, whatever you have, use it, because you're trying to correctly identify the patient relative, because talking to a wrong relative about another patient is also a big red flag. So definitely identify the patient that you're talking about. Full name, I'm still emphasizing on this fact, and age. These are the information. If it's a telephone call, you have one more identifier, which is the address. So always confirm who you're talking to or about. So let's go through the case quickly. So setting, you identified the person. Perception, that was very good. You understood, what happened to the patient. So Dr. Mishi gave you all the information right away. He collapsed, non-responsive, took him to the hospital. They said it was stroke, and he's not been improving since, and it's been 1 week. So she gave you all the information. Most of the time, they only give you some information at a point, and you're supposed to be timeline of what has happened. What is the first event that has happened, what happened after that, and to the current state right now. So sometimes, you need to understand how much of this progress does she know. Does she know that the father is not improving? Does she know that there was a recent scan also that was done? These are things that you need to ask. Has anybody spoken to her about this at all? You need to understand what all she knows before you break the news. And then the other information that you need to find out is about the family structure, who is in the family, who takes care of the father, anybody dependent upon this person, right? Does he have an advance directive? Is there a last power of attorney with someone, right? Has he chosen that person? So that would be a perception. Then give your invitation, right? Literally, if you're all right, I'd like to talk about your father's condition right now, or would you like anybody to join you while we talk about your father's condition? And then go on to the knowledge part, where you start by explaining what she already knows to what she doesn't know. And then the last thing I'm going to say is the worst thing that you have to say. So that's why we say always layer your, information when you're breaking the bad news. Layer it from the point of what she knows to what was done, to what was found out, and what is the worst thing you have to say. So, would you like to give it a try again? Would you want to say the breaking bad news part, the knowledge, how you would say it? Do you want to try? Does anybody want to try breaking this news? If you had to, give just the knowledge part. Guys, anybody interested? Yes, Dr. Anote, go ahead. Go for it.
Okay, so if the patient's name is Tucker, the doctor's, and I'll say, okay, So I'm so sorry. Unfortunately, your father, the multidisciplinary team has assessed your father's condition. And after looking at the findings of the CT scan,
No,
it's
she
not
doesn't know there
likely.
was a CT scan. So until now, she doesn't know there was a CT scan. All she knows is that the father was admitted 1 week back, and they've been treating him to get better, and he has not been getting better. And nobody has spoken to her till now. That's the information you've gathered. So how are you going to break the news now?
So the multidisciplinary team has assessed your father's condition. And I'm afraid I don't have very good news to tell you. Would you like for someone to be here while I share this news with you? And then she says yes or no. If she wants somebody to be in the So we have looked at the CT scan results. Did anybody tell you about the test results? And she replies, no, nobody told me about the test results. Said, unfortunately, the extent of your father's brain affected by the stroke is quite large, and so the brain has been severely damaged, and he's not likely going to recover from this. I'm so sorry to have to tell you this, Ms. Tucker. At this point, we're trying to make sure that we keep him comfortable, and we're not going to perform any aggressive measures regarding his condition.
Yes, thank you, Dr. Anote. That's good. That's good. That's definitely a good approach. But the approach usually that I follow, I don't reveal the fact that I have bad news until after I've given the invitation. I would say that I'd like to talk about certain what to say important what to say I'm not getting the word. Important information, important development that has happened regarding your father's condition. Would you like anybody to join you while I discuss this? Right. So the layering thing that I'm trying to tell you is that you're trying to keep them and on the same page. So when you start with this, start by saying, I would start by saying, as you already know, your father had suffered a stroke 1 week back. And unfortunately he has not been responding to the treatment for improving his health. And we recently did a CT scan which showed that there was a large part of his brain that was damaged, and he is very unlikely to recover from this. This is the worst part of the news. So I would want her to, I would stop there, and I would want her for that news to sink in. So I will stop and let her react, ideally. Because every time, always when you're breaking the news, understand which is the worst part of the news that you have to talk about and give it last, from the part which she already knows to what has happened right now, right? So now, by saying that he's unlikely to recover, then she will have a reaction. You are supposed to respond to that reaction. That is exactly the whole interpersonal play that goes around. Because you immediately, you tell her that he's unlikely to recover, but we're trying to keep him comfortable. That will come later into strategy and management. So after she reacts to the thing that, so after knowledge there is a big part of emotion where she wants to, you want to identify the reaction, and you want to direct her to the right resources that she could avail, right? She would tell you the worst fears of hers during that time, when you tell her that her father is probably not going to survive this, right? So you want to respond to that emotion. So make sure that give her that space. That's very important, right? And that's a big play on interpersonal skills there. And afterwards, then she'll ask like, what's going to happen next? What does that mean? So then you bring in the fact that the multidisciplinary team has assessed his condition, and they are planning to convert his current treatment to something that we call palliative care. Is that something that you've heard of? So currently, so the next important thing to identify over here is that this person has been, the management that was being done was curative. It wasn't palliative. So now we are changing from curative to palliative. So you need to make that clear to her. You know, the treatment that we are offering is going to change at this point. And then go on talking about the palliative care. So there was another thing that came up in this conversation. Will you be giving the normal medications for the BP and cholesterol in this palliative care case? Anybody, any opinions? No, Dr. Anote is saying. Anybody else has any opinion? And but why, Dr. Anote? Why won't you be giving? He's already been on this medication. Why stop the medication that he's already taking?
So at this point in palliative care, the focus is not to treat the illnesses. The focus is to preserve his dignity and keep him comfortable for the last stages of his life. So the medications we were taught were medications to reduce secretions and to give him painkillers, and that's about it. And keep him with oral sips and some nutrition.
Yeah, but you know, identify who the patient is. This patient is comatose. Can he take any oral medications? Can he take any oral sips at all? Identify what are the medications. So usually, you know, what you give for BP lowering and cholesterol medications come in oral form. You can't give them any oral medications at all. Palliative care mostly is all subcute. So you need to identify that the whole treatment regime itself is different. The route of treatment itself is very different in case of palliative care. Right. So that is another thing that you can add on, saying that we cannot give him any medications that he usually takes because it's usually taken in the oral route. That could introduce another risk of aspiration. That's one thing. And the other thing is absolutely like you said, explain what these medications. So would you give him any antithrombotic medications in this case? Like, you know, mostly bedridden patients usually do get like a prophylaxis of heparin. Right, would you actually do that for this patient?
Subcutaneous heparin, yes.
But would you do that? Is that a part of palliative care? That's not one of the palliative care patients. Yeah, do we have any hands? Anybody have any opinions? Like, would you actually do that? Would you give them subcutaneous, you know, heparin prophylactically? Yes, Dr. Amoko, please go ahead.
I don't think there is need to give any medication for possibility of coagulation.
Yeah.
Because the patient is already dying and it's more or less like end of life care for the patient.
Absolutely, you're absolutely right. Absolutely. In this case, I mean, it's not serving any purpose, right? But I have to add that there are certain long-term conditions, palliative care where patients are bedridden, they are given, but that is usually the palliative care team, and that's more of a, you know, specialist call. But usually, you know, they try to avoid giving any kind of other medications because the medication that he was actually taking was for a purpose of, you know, preventing any issues that kind of has already happened. So they don't play much of a role in anything at this point. It can cause hemorrhagic conversion too. There you go. There you go. No, but doctor, there is, you know, a prophylactic dose that usually can be given, especially for bedridden patients, because they are at a very high risk of DVT. Usually, if they are bedridden and they're not moving for a very long time. No, in this case, particularly, yeah, you can say, but you don't know the type of stroke that this patient is having. They just had damage. You don't know if it's a hemorrhagic or, you know, ischemic, right? But for this case, particularly, you will not be giving any prophylactic antithrombotic. So yeah, but I just deviated a little. That was just a side note. But yeah, guys, always question everything. Understand why something is happening, you know, so that you would be able to explain it better to the patient, because that's exactly what you're required to do. So let's just quickly check the performance. All right. Explain better, did not discuss the nasogastric tube. That's very good catch, Dr. Anote. So what is your task? Make sure to mention what is the task, whatever is the task, make sure you mention all of that, right? Stop the treatment, remove the nasogastric tube. If the things in the candidate information has been mentioned and you did not bring it up in your consultation, you're going to lose a lot of marks. All right. Everything in the candidate information needs to be relayed to the patient. And that's basically your task. So apart from the task, you're supposed to find out other issues, right? So do not, do not oversee what the task is. So make sure you keep to your task, right? So greet the daughter. What was missed? Explore any known patient wishes, advance care plans or lasting power of attorney. Yes, we addressed that. Doctor's main concerns, expectations, yeah, any religious beliefs. Yeah. So always do ICE, especially in these cases. Yeah, ICE is a very important, tool to uncover what exactly, is the main concern of the patient or the relative that we're talking to. Yeah, even Dr. Anori also marked patient's age and the name is very important, right? Yes. And where you are a part of the palliative care team. So do introduce yourself like that, right? Because those are all given in the information. Summarize the main points and ensure the daughter understands the information. At no point did you actually manage to do that. That's the whole point of the spikes protocol. So when you're dropping the knowledge, you are trying to make sure that, she understands everything that has been told to her. Hence the pause, hence, that interval for her to express herself. That is very important. Provide safety netting by offering to contact information for further questions. Yes, that's also something that could have offered. Offer supportive resources, follow-up conversations if needed. Clarify why active treatment is being withdrawn, especially stopping medications and no longer providing benefits and removing NG tube, right? That's an important point. Otherwise, describe what palliative care involves, such as pain relief management, symptoms like breathlessness, agitation, and preserving dignity. Deliver bad news, explain clearly, unfortunately, due to the extent or exactly. Yeah, I think Dr. Anrita, you also got that point. When you are actually breaking the news, you have to break it completely to the point where you're saying, what is the prognosis here? Like, what is the thing that we're trying to tell you, right? Like, don't leave them hanging for them to, figure it out. But otherwise, interpersonal skills are pretty good. So, good job on that. So, good job, Dr. Meera. That was a great great consultation. It will just quickly take down the scores.